So finally, let's talk a little bit about next steps and moving forward. First is the question, how do you actually come to a final decision about treatment? Now, it's very common and typical to really focus on things like, well, don't you want a minimally invasive treatment? Or to rely on anecdote and stories. My neighbor had proton therapy and did great. I tend to caution patients against this for two reasons. First of all, in terms of the invasiveness question, what you really need to focus on is long-term outcomes. Obviously, we try to avoid surgery if possible. We try to avoid invasive treatments when possible. But the fact is, if you had to undergo a surgery to achieve a better long-term outcome, well, that's a good trade-off because the implications of the decision in terms of how to treat prostate cancer, you're going to live with for years and for decades. So we really try not to focus on what the short-term actual procedure of the treatment looks like. And again, it's easy to fall into anecdote and looking at a friend or a neighbor, or advertising materials from a robot company or something else. The thing about prostate cancer being so common is that we have very good data on how men do after treatments, and individual centers should have very good data on their own experience. All the numbers that I've been quoting in this set of videos are based on our experience here at UCSF. So definitely review data in detail with the team of clinicians that you're going to see, whether at UC or elsewhere. You can get second opinions, you can get third opinions. You almost always have time with a prostate cancer diagnosis to collect enough opinions that you feel comfortable that you know a good path forward. And it's always encouraged to check in with your primary care doc as well. If you have a good relationship with that provider, they can give another very valuable perspective on weighing the relative importance of differences in survival versus impacts on your quality of life. Talk it over with family, talk it over with friends, and if you think it will be helpful, by all means, come to one of the support groups that we run all over the Bay Area, or that can be found in most other major centers in the country. Now, do you have to come to UCSF or to another major center? The answer is, it depends. Outcomes from all of the treatments we've been talking about in these videos vary widely from place to place and from physician to physician, even within a center. There is no question that the quality of care and the outcomes of care tend to be best at high volume centers like UCSF. We have exceptional depth and breadth of expertise. Prostate cancer tends to be what we eat, breathe, live, and sleep in managing really all aspects of prostate cancer care. But at the end of the day, you really need to be comfortable with your individual team, and you need to ask a lot of questions in terms of what the local outcomes are and local expectations. Ask questions about how the data are collected and how does a given physician know what his or her outcomes look like. Other things to think about. Diet, exercise, lifestyle are all very, very important. Maintaining a healthy diet and doing a lot of exercise can greatly facilitate your recovery after treatment, whether we're talking about surgery, radiation therapy, or hormones. The good news here is that you don't really need to worry about a prostate diet versus a cardiac diet. Generally speaking, there's good food and bad food. And what's good for the heart, on average, tends to be good for prostate cancer risk and tends to be good for recovery as well. So in terms of eating well, you want to minimize saturated fats, minimize simple carbohydrates like starches, white rice, pasta, bread. These things are fine in small portions, but should not be the basis of your diet. Avoid processed foods. One of the one-liners is if you have to unwrap it, you probably shouldn't eat it. And try to go around the edges of the supermarket. Try not to walk up and down the aisles at all as much as you can avoid it. Certainly avoid smoking. There are a number of specific reasons you should stop smoking if you have a prostate cancer diagnosis. Smoking increases the risk of the cancer progressing. It's also bad for sexual function and bad for urinary recovery as well. And then, as I mentioned in the section on hormonal therapy, exercise, both cardiac exercise and weight bearing, is very, very important to keep your muscles and bones strong and keep your cholesterol and blood sugar in check. And the QR code in the lower right here will take you to a whole separate page that we maintain on exactly these sorts of interventions and considerations, as well as trials that we're running on interventions in terms of lifestyle for men with prostate cancer. Which takes us to the question of clinical trials. So we and other academic institutions are constantly looking for better ways to manage prostate cancer, better ways to diagnose it, risk stratify it, and manage it. So at any given time, there may be opportunities for you to participate in a clinical trial for any one of these questions: screening, diagnosis, management, to try to determine whether a new test or a new treatment might be better than the current standard of care. If any of these are available, we will let you know when you come for the visits. Participation is, of course, always completely optional. We will go over the potential risks, potential benefits of any new test or treatment, but this is always something, a space to keep an eye on, especially at places like UCSF, where we really are constantly trying to drive the standard of care forward. And finally, I'm going to end with one of the first things I said at the beginning of this series of videos, which is stay positive. It is really critical to remember that prostate cancer is almost always slow growing, with nearly 100% 5-year survival for even the high risk localized tumors. And these days we have more drugs coming out every year than we honestly know what to do with and how to sequence them for men, even with advanced prostate cancer. So survival is better every year. And most of the side effects of treatment can be managed. So I mentioned it along the way here, nobody should be suffering in silence. If you do have urinary problems, bowel problems, sexual function problems after treatment, speak up, because there's almost always something we can do to help. And again, you have time. Take a deep breath. You have plenty of time to collect the information you need and to make management decisions that make sense for your priorities, and will be a decision that you'll feel good about going forward as you move into treatment and into survivorship. Finally, questions, you're going to have lots of them. Write them down, bring them with you to the visit. If you can, bring a partner, a friend, family member to the visit, whether it's on telehealth or in person. Bring an advocate with you, somebody to help you take notes, help you remember your questions. I can't think of any clinicians around UCSF who object to the visits being recorded. In fact, we encourage it. You know, smartphone can do this. It's very easy to do, and it's great to be able to come back and reference the conversation after the fact, because it can be a lot of information to take in. So with that, thanks for your attention. One more time, here's the QR code that will go to the website that we keep updated. I will update these videos from time to time, but the website will be updated probably a little bit more frequently. And I'm going to end with a massive thank you to the UCSF patient advocates who have been tireless in their support of our program for 20 years in all aspects of our clinical care and research, and who have, in particular, really given phenomenally helpful advice in terms of preparation of these videos. We're always open to feedback, so please contact us with information that you think is missing or things you would like to see added. And we look forward to meeting you.